Aura Wellness announces breakthrough PEMF technology for prostate health with 27% size reduction in clinical case study. Welcome back to PEMF Today, the show where we dig into the science, the stories, and the people rewriting the playbook on human health. I'm your host, Pat Zemer, and today we're exploring a condition that quietly affects millions of men: benign prostatic hypertrophy, or BPH, and a fresh approach that just posted eye-opening results: pulsed electromagnetic field therapy from Aura Wellness. Aura Wellness recently announced groundbreaking research demonstrating the effectiveness of its pulsed electromagnetic field PEMF technology in treating benign prostatic hypertrophy (BPH). The study, published in the Journal of Regenerative Medicine and Biology Research, showed an average 27% decrease in prostate size over 30 days with no adverse effects. Let that sink in: 27% in a month, using nothing more invasive than electromagnetic pulses. If you're new to BPH, here's the quick primer. The prostate is a walnut-sized gland that sits below the bladder and wraps around the urethra. As men age, that gland often grows, sometimes just a bit, sometimes a lot. The swelling can pinch the urethra like a kinked garden hose, leaving men with slow or frequent urination, interrupted sleep, and chronic pelvic discomfort. Traditional treatments start with medications, and when symptoms escalate, may move to surgery. Both routes can bring side effects, and neither is a guaranteed fix. Today we're taking a deep dive: what PEMF is, how this study was designed, why the results could shift the BPH landscape, and how early adopters might integrate the protocol safely. First, the science. Pulsed electromagnetic field therapy (PEMF) delivers rhythmic magnetic waves that penetrate tissue, coaxing tiny electrical changes at the cellular level. Think of it as hitting a reset button for cellular energy. The pulses enhance microcirculation, improve oxygenation, reduce inflammatory signals, and nudge cells toward balanced metabolism and homeostasis. Over the past 2 decades, PEMF has earned FDA clearances for bone healing, post-operative pain, and even treatment-resistant depression. Now BPH is on the radar. BPH is mainly driven by chronic inflammation and microvascular congestion. When blood can't circulate effectively, tissue swells and normal hormone signaling goes haywire. PEMF punches through that logjam. The rhythmic pulses dilate tiny blood vessels, increase nitric oxide signaling, and improve oxygen and nutrient delivery. Simultaneously, they downregulate inflammatory cytokine pathways. Over time, that dual action lets the prostate decongest and remodel itself. The research, conducted by Dr. Roberta Klein from the Department of Human Nutrition and Functional Medicine at the University of Western States in association with Leonard Getze, Ph.D., Dr. Robert Bard, and Dr. Paul Dreschnack, examined 3 case studies of males with benign prostatic hyperplasia (BPH) who received pulsed electromagnetic field PEMF bioenergy technology sessions using Aura Wellness's Nova HD Plus FDA cleared devices. My family has a history of prostate issues, and when I was told that it was my turn, we put an 8-week plan in place that was very successful. When my biopsy was performed 8 weeks later, the growth was dead, and I have remained clean for over 15 years. I go to the Bard Cancer Clinic every 6 months for an ultrasound of my prostate, kidneys, bladder, and arteries. This case study represents a significant advancement in non-invasive approaches to a condition affecting over 80% of men by age 80. My daughter, Elaine Zemer-Pauley, our company president, has shared on her live weekly broadcast that BPH is the most common benign urological condition in males. It often requires medical or surgical interventions that can carry risks and aren't always effective. As Elaine has shared, the Aura Wellness PEMF technology enhances cellular oxygenation and blood flow to the affected area, reduces inflammation, and enables the body to heal itself. The research team, led by Dr. Klein, developed a moderate dosing structure that would be comfortable for all participants and sustainable schedules that the participants could easily follow. Beyond the measurable reduction in prostate size, participants reported less pain and discomfort and improved urine flow, with initial changes typically noted within 1 week of starting the protocol. Inflammation and loss of vascular function are the root of many problems. Our model is to provide non-invasive procedures with no side effects to achieve optimum homeostasis. This could reduce the need for surgery and the amount of drugs needed. Aura Wellness provided and directed the operations of the Nova HD devices, while Dr. Klein and her associates independently conducted the scientific research with no further involvement from Aura Wellness. The study's independent status enhances its credibility, and its findings could have far-reaching implications for men's health. As Elaine has pointed out, any validation step forward helps the medical community accept the PEMF modality. Thus, Aura Wellness and MagnaWave are actively involved in facilitating research in the human and veterinary fields. Aura Wellness is allocating research grants and loaner devices to clinical partners. Our mission is bigger than device sales, legitimizing PEMF as a first-line option so men can address BPH earlier and avoid medication cascades. Dr. Klein states, "One of the biggest challenges for healthcare professionals is that the research often lags behind our clinical knowledge and experience with new technologies. This report on a series of case studies is essential in advancing our understanding of PEMF and its use in addressing common disorders such as BPH. Listeners, if you or a loved one is dealing with nighttime trips to the bathroom, here are 5 questions to ask your healthcare provider. 1. Could my urinary symptoms be linked to prostate enlargement rather than infection? 2. What are my current prostate volume and PSA metrics? 3. Am I a candidate for non-invasive modalities like PEMF? 4. How will we measure progress ultrasound symptom scores flow rate? 5. Are there any contraindications for my particular situation? Stay informed. BPH is common, but suffering isn't mandatory. Bring articles like ours to your urologist and have an open discussion. The link to the full case study is in the show notes. It's a quick read and worth sharing at your next appointment. Future horizons. We have hinted that preventive PEMF could delay prostate issues, so let's paint that picture. Elaine says, think of brushing your teeth to avoid cavities. We envision men in their 40s using moderate PEMF once or twice a week, 10 minutes, to keep vascular and inflammatory markers in check. Over the decades, that could translate to fewer severe BPH cases and fewer surgeries. The beauty of PEMF is its safety margin. You can integrate it alongside exercise, diet, and targeted supplements. Versatility is a key component. We're working to study PEMF for osteoarthritis, neuropathy, cognitive decline, depression, skin disease, medicinal enhancement, and a myriad of other indications. If we can show robust benefits across systems with minimal risk, we'll shift the paradigm from disease management to proactive regenerative care. That's today's program, an inside look at how targeted electromagnetic pulses are shrinking the prostate and maybe reshaping men's health. I thank Dr. Roberta Klein, her associates Leonard Goetze, Ph.D., Robert Bard, Maryland, Paul Dreschnack, Maryland, and Elaine Ziemer-Pauli for their candor and trailblazing work. If you found value in today's episode, share it with a friend and drop a review. It helps the show grow. For links to the study, Aura Wellness, and resources on BPH, head to the Hyro app and YouTube show notes. I'm Pat Ziemer. Until next time, stay curious, stay proactive, keep pursuing your breakthrough, and wave on to better health. The information in this podcast is educational and does not substitute for personalized medical advice. Always consult a qualified healthcare provider before beginning any new therapy.